I've been through it all. Hyperpigmentation just means a state of excess pigment production. The face alone, I can name more than 10 causes.
Okay, wow.
Obviously, sunscreen is non-negotiable. Retinoids, those are kind of the backbone in treating lots of hyperpigmentary disorders.
In today's episode, we are talking about a condition that affects a very large portion of the South African population. It's not only a physical condition, it also has a very profound emotional toll. Today, I want you to remember more than ever that good skin starts with good science. Welcome to That Skin Show. I'm Dr. Adia, and in today's episode, we are discussing hyperpigmentation. To help us unpack this very complex topic, we have got the perfect guest. She is a world-renowned speaker, a lecturer, she contributes to dermatology textbooks, and she has a very special interest in skin of color. I'm so excited for you guys to learn from her. She is none other than Dr. Nokubonga Khoza. Dr. Khoza, welcome and thank you for taking the time to be with us.
Thank you. Thank you for having me.
I love starting the episode with a personal skin story. I think what patients don't always understand is that we are also human and we also go through some sort of skin journey. And I'd love to know a little bit about your skin journey.
I've been through it all. And I think probably that journey has made me or has sort of like steered me to some of my interests today or my passions in dermatology. I've suffered from comedonal acne as a teenager. In fact, at that time, my mother took me to a local GP who actually started me on 1% hydrocortisone and some other things. And so from that, I actually got steroid-induced acne and steroid-induced dermatitis. Didn't make sense to me then, but now working back, I know. What was my saving grace actually was that we actually ran out of money to pay the doctor's fees and also to buy the tube, which really made a difference. It made me lighter, it made my skin smooth, but every time I would stop it, my acne will flare. So from comedonal acne to steroid-induced acne, steroid dermatitis, I've also experienced adult onset acne. In fact, I experienced that during my years of training as a dermatologist. And obviously I went on treatment. And when I was struggling with the post-inflammatory scarring and the marks, I went on low-dose isotretinoin. And I remember the first time I got a wax during that period. And I got burnt, like literally a proper burn. And obviously that left scars and pigment that I had to sort of treat afterwards. But that was when I learned that isotretinoin, you should avoid facials, you should avoid waxing. I didn't learn that from the package insert. I actually learned that from my own experience. So I always tell my patients who I'm starting on oral isotretinoin, do not wax. So that was my, my journey. I have sunspots, which I'm currently treating because I'm aging.
I wouldn't say so.
I have alopecia. I've had chemical burns that have resulted in, loss of hair from relaxers.
Oh, wow.
I have traction alopecia, which I'm currently treating. So
you really have had it all.
Yeah. And as I say, it's funny how those conditions that I've gone through have kind of become my niche or an area that I am passionate about or known for.
And I think you share those emotional, personal connections with the patients that are going through the same thing. Sometimes patients are embarrassed to come to the doctor because, of something like traction alopecia. But I think you have a unique point to kind of reassure them that, me too, it's okay, we're gonna get it fixed. Okay, so Dr. Khoza, if I then went into your bathroom and I opened your bathroom cupboard and I peeked inside, what ingredients would I find?
So I am above 40. So my skincare is not normal. It's not the norm. It's not what I teach people. but I'm very intentional and very strategic.
Okay.
And everything that I have is just carefully selected and carefully considered. But I am, and obviously as a dermatologist, we're always changing products. We're always cycling. It's part of the
Constantly
job.
trying something.
Skin cycling is
Yeah.
part of a job when you're a dermatologist. So we're constantly trying products for companies or different brands. But I just, it's almost like I have a set principle, and that's what I teach my patients as well. So my cleansers, you're going to find 3 cleansers in my cupboard.
Okay.
So I've got a foaming cleanser for the morning. I've got a
Yes.
very gentle, creamy cleanser for the evening. And I've got a glycolic acid cleanser for once a week.
Yes.
And then I have
Important to note, once a week. She's not
Yes.
using a glycolic acid cleanser
no,
every
no, no,
day.
not every day. If I remember that once a week, but it's there.
Exactly,
It's like
exactly.
literally for my weekly exfoliation. When it comes to moisturizers, I have one moisturizer, and I use the same moisturizer in the morning and in the evening, but it's the
Perfect.
richest and it's the creamiest, so I don't compromise on my moisturizers. And then I have a sunscreen, SPF 50. I use the La Roche-Posay Enthelios. And I
I think all of us do.
yeah, so not just for the fact that it's a great sunscreen, it's the formulation that works well for me, because I layer so many products, and I find that some sunscreens, when you are layering the last layer, it kind of rolls. So it doesn't, it's not fine, it's perfect in terms of it's cosmetically acceptable, but it's that rolling effect that sometimes make me not use certain formulations.
I always say to patients, this is an amazing sunscreen, and it works like a primer to your makeup.
Yeah, no,
like
it's wonderful.
It just, you've got no issues. Yeah.
It sits nicely with the many layers that I've put. And then I have retinoid. It's always going to be prescription retinoid.
Yes.
And then I have my vitamin C or my antioxidants.
Yes.
That I use in the morning. They're going to be the most expensive. So really, we always say to people, skincare doesn't have to be expensive. My skincare is very expensive because I'm above 40. So I really buy value.
Yes.
I buy science as well as
Yes.
research that has gone into
Yes.
every single product.
Yes,
And that's
exactly.
how I create my skincare routine.
I think something very important you said was, even though it is expensive, you are picking products with a lot of science, because there are expensive luxury products out there that don't have a lot of science. And then you are spending a lot of money on something that is not necessary. But if a product, has gone through clinical studies and we have results showing that antioxidant is going to do that thing,
Yes.
then it is worth the spend.
Yeah. And I think I'm also just in a fortunate position to have access to skincare and to many, many products, and also access to the data and the research. And then that informs
Your decisions.
my decisions.
So we briefly touched on antioxidants, and maybe we'll dive back into it in the episode. But let's maybe just start with hyperpigmentation. Now, for those of you that don't know, hyperpigmentation is not a diagnosis. It is an umbrella term. And under hyperpigmentation, there are different disorders. So maybe you can start by just telling us what those are and kind of just the basics of how they work.
So I always explain it very simply. Hyperpigmentation just means a state of excess pigment production.
Okay.
And that is just visible excess pigment production in comparison to your other or underlying skin tone. Now, there are so many causes. Now, if you look at the face alone, I can name more than 10 causes of why you may have a hyperpigmentary state. Commonest being acne-induced hyperpigmentation. And then obviously post-inflammatory hyperpigmentation. So that could be anything. That's from your eczemas, fungal infections, cosmetic products or irritation.
Burnt yourself with a straightener.
Burnt yourself, yes. Yeah, a burn. Or burn yourself from waxing.
Yes.
So that could be anything that causes injury to the skin can result in post-inflammatory hyperpigmentation. But you could have maturational hyperpigmentation, which is really related to your metabolic syndrome. You could have lichen planus pigmentosis, which is very, very common.
Yes.
Melasma, which is hormonal. Sunspots, which is UV exposure. Perioral or periorbital hyperpigmentation, again, whether that's a form of post-inflammatory pigmentation or not. So it's quite a lot of conditions. Acanthosis nigricans, which also happens in patients who have insulin resistance. Now, I know that's not a true pigment, but physically
it is presenting
as darkening of the skin. So there's quite a lot, and we can go on drug-induced hyperpigmentation. That's also something in patients who take maybe non-steroidal anti-inflammatories. Something as easy as hypertensive medicine, which sometimes will cause pigmentation in the face. So it really, really is a big description and many, many causes. You then work backwards in terms of how to treat. So if you've got acne-induced hyperpigmentation, you really want to control and treat the acne.
Yes, you want to start with a root cause, and that's why that root cause is really important. And I think Dr. Khoza is making a very important point here, especially on social media. Hyperpigmentation, that term is thrown around a lot, and people are sharing what they're doing for their hyperpigmentation. But if you don't know what your specific cause is, and you don't have a specific diagnosis, then that treatment is not going to be correct for you.
Definitely.
All right, so you've briefly mentioned melasma, and I think melasma is extremely common. Can you maybe just elaborate on exactly what melasma is, what it looks like, and what treatment options do patients have?
So melasma, historically referred to as the mask of pregnancy or cloasma, because first or commonly noted during either pregnancy or in relation to hormonal fluctuations. So that may be when you're pregnant or during menopause or perimenopause, or when you start or you stop your oral contraception. So I always, but we know that it's not just the hormonal triggers now. Melasma has kind of opened up in the recent years in terms of the many triggers that may not necessarily be related to hormonal changes in women. But typically it's that hyperpigmentation that happens on your cheeks most of the time in a symmetrical manner. Also in the temporal areas, can go up to the forehead, typically in a mask of Zorro, around your lips. But it can be anywhere. You can get melasma in your chest. You can get melasma in men, which some people may not know, but it does happen. So I always walk my patients, and I always talk about 5 pillars when I talk about melasma, and when I draw it up for them in that manner, it actually just helps me with a lot of things. So first of all, we always talk about the triggers, and then we always talk about what they do at home, so that they also, in this diagram, they also see where they feature, and then that also helps me explain the treatments. So I'll tick each column if we have treatment that speaks to that. And usually my 5 pillars, I start off with the sun, UV exposure. Then I'll say
our
to
biggest
them,
culprit.
really, really, never ending thing, especially when you're in South Africa. So I'll speak about the role of the sun and what we can do. Then I'll speak about heat, which is a new theory. We know that heat now, whether it's from your sauna, yoga, cooking, or open fires, we know now that also triggers melasma, whether it's from inflammation or the activation of mast cells, as well as neovascular or dilatation of your blood vessels. So that's quite a big theory that we didn't know in the past. And then I speak about skin barrier, because I always say to them, you know what, so whenever I go UV exposure, heat, skin barrier, my next one is inflammation, but it just highlights the role of inflammation in melasma before we even get to the pigment production. So I'll speak about the skin barrier, and I'll say to them, you know what, not only is it, we know that a defective skin barrier promotes inflammation, but when we're treating, it's so important that you use moisturizers that will support that and address that to minimize inflammation. And then my 4th category is inflammation, because we know that it's the inflammation that drives some of the reactive melanocytes and that increase activity that then lead to the pigment. And then with pigment production, I'll speak to them about genetics. I'll speak to them about hormone.
Yes.
So once we have our 5 pillars, then I'll say, okay, now how do we address the sun? You know?
Not by only putting sunscreen on when you are in the sun.
In fact, I've moved away from talking about sunscreens initially. I always talk about what are sun protective methods. Because when we focus on, just sunscreens, patients then, think if I just put a sunscreen, that's enough.
Yeah, then I'm fine.
So it's
don't have
usually
to
the
think.
last point that I will speak about. I speak about avoiding the sun shade,
Yes.
your hat. A lot of our patients are gardeners.
Yes.
A wide hat, your sunglasses, before I get to sunscreens, and the fact that the sunscreens need to be applied every morning, but they must be reapplied if you're suffering from melasma.
Yes.
Every 2 to 3 hours.
Yes.
And that opens the conversation for what formulations are great as topping up, and also just some oral sun protective or sunscreens that we have available. And also, we talk about SPF 50, we talk about broad, and also we bring in the visible light when we talk about that sunscreen. Then I'll say to them, no steaming, no saunas, and no hot yoga. Because, or if you do, then cool yourself or figure a way of cooling yourself. Then when it comes to skin barrier, I always recommend good moisturizers. I always also recommend prescription anti-inflammatories as part of my treatment routine. And then pigment control is then now a big one. Because from the use of hydroquinone, which we know we can only use for a limited period, to the use of the newer agents like your cysteamine, thymidol, melasil, and how they feature in terms of the treatment. We talk about antioxidants like vitamin C's. I always talk about retinoids, and I choose my patients in terms of which ones I will put on a retinoid and which ones I would not.
Yes, absolutely. Depending on the base sensitivity of the skin. Because retinoids they're not a blanket treatment. If your skin is already sensitive and you are adding a retinoid, you can potentially kick that inflammatory process into motion, making your pigmentation worse. And that's why tailored care, like you're explaining now, is so important.
Yeah, and I think also then I'll cover all the, in-office treatments, the role of chemical peels, the role of lasers, the role of microneedling. So I find that if I draw it out for them, then it's easier. We'll say, okay, what have we done for
pillar
this?
1.
What are we doing for pillar 2? What are we doing? And then pillar 4 always has the most ticks.
Okay, so
pillar 5.
In pillar 5, I think a lot of focus is on pillar 5, and I would love our audience to understand just very basically the pigmentation process. Because if they can have a basic grasp of it, understanding kind of where products work and which ones they can potentially opt to get off the shelf, I think will really empower them.
So there's a lot, that we use now. Now, the process of pigment production, which we call melanogenesis, it has a lot of steps.
Yes. Let's focus on the very basics.
And so when you think about melanin, we know that melanin is produced by these specialized cells called melanocytes, which are found in the skin. So it's almost like a production line in a factory.
Yes.
And then so if you don't do anything, it is going to carry on in that manner.
Yes.
And so these different products with these different ingredients, you can put them at any point of this production line and they're able to stop the factory from producing anything. That's how I always think about it.
Yes.
So if you're looking at something like a retinoid, for instance, a retinoid, we know that it increases cellular turnover, and so that's shedding of the pigment cells. But we know that it can also block a very important step within this production line, which is tyrosinase inhibitor, and that's quite a rate-limiting step in producing pigment. Now, beyond that, if you use them long term, we know that retinoids can also interfere in terms of melanin transfer. So now that's now the transport mechanism where your pigment is transported from your melanocytes into the keratinocytes.
Okay.
That's just retinoids, you know. Something like niacinamide, for instance, is more of an antioxidant, in that not only does it help in the reducing what, let's say, UV-induced damage. The name is oxidative stress.
Yes.
I don't have another name for it. That's
ROS.
Yeah. So it has a role in reducing inflammation, but it also has a role in the transport, in interfering with the transport mechanism where pigment is sort of transported from the melanocytes into the keratinocytes. Now, a lot of ingredients have focused on tyrosinase inhibition, and then newer ingredients like melasil now will act before that.
Okay.
So if you have all these building blocks in building melanin, melasil now can interfere or disrupt that process of building the pigment.
Okay.
So you're able to control or treat or prevent the pigment before it actually forms. But what I like about how we are now finding out lots of ingredients, and with having the sort of like the understanding of this pigmentation pathway, is that we can now say that I can use 5 ingredients because I know that ingredient 1 is working in step 1,
place,
ingredient 2 is in step 3, provided that they don't clash with each other. But we are able to use a little bit more than one traditionally that we had, like hydroquinone, in treating pigmentation.
Okay, incredible. So to summarize for you guys, think of the melanogenesis process as a little factory, and multiple ingredients work at different areas. And that's why getting proper advice, a proper diagnosis, and a proper tailored treatment plan is important, because we can put different ingredients to work on different areas, but we also need to make sure that these ingredients don't cross-react and kind of worsen the whole process. Dr. Khoza, you've shared incredible information, and I think we could go on for another 2 hours. But what I would love for you to share is just your top 3 tips for managing pigmentation, as well as what you wish every single patient knew when they walked into your office.
So my top 3 is, I always say sunscreen is non-negotiable, because it's the one product or ingredient that we have that actually prevents pigment. Everything else treats, except sunscreens can actually prevent pigment production.
Amazing.
So that's usually my first. My second will be retinoids, actually, because I think those are kind of the backbone in treating lots of hyperpigmentary disorders, provided that you've chosen your patient carefully. And that's because they're able to work at multiple steps. So they really are good multitaskers in pigment production. And then number 3 will be all the others added together. Because at the end of the day, the aim is to reduce pigment and also reduce the visible hyperpigmentation that you see.
Amazing.
What is the last one? If what is
you
the
wish
one thing?
what you wish every patient knew, and it doesn't have to be pigmentation related. I mean, working as a dermatologist, you have feet through your door every day. What do you wish every patient knew?
You know what I wish people knew was that dermatology actually is a science, and also it's a lot of it is understanding the chronicity of diseases, and that when you walk in, it's going to be a journey. And also you need to be patient, because the results don't come quickly. And also it's just that partnership between you and the doctor. I always say to my patients, you're going to learn a lot of things, but you're also going to unlearn a lot of things that you thought you knew about yourself and the skin. So there's no quick fix. It really is a walk, and sometimes it's really, really hard.
Dr. Khoza, thank you for sharing your knowledge with us. And I do think that, people who struggle with pigmentary disorders are going to feel a little bit more empowered on their journey. Guys, you heard it from the expert. It is so important to get a specific diagnosis for your hyperpigmentation disorder and to reach out for a tailored skincare routine and to go on a journey with your practitioner. As always, it's important to remember that good skin starts with good science.
If you feel overwhelmed by the amount of skincare information online, then hit subscribe as we unpack the science behind the most common skin conditions.